वेलकम बैक टू आवर चैनल नर्स अड्डा। आज हम लेकर आए हैं आप सब के लिए नॉन नर्सिंग सब्जेक्ट्स के मोस्ट इम्पोर्टेंट एग्ज़ाम ओरिएंटेड MCQs। और ये क्वेश्चंस नॉर्सेट, CRE, AIIMS, ESIC, RRB, DSSSB और अन्य नर्सिंग ऑफिसर एग्ज़ाम्स के लिए बहुत यूज़फुल होने वाले हैं, तो बिना स्किप करे वीडियो को एंड तक ज़रूर देखिए। तो डेली 500 MCQs के लिए चैनल को फॉलो करिए और सब्सक्राइब करिए। चलिए शुरू करते हैं। तो पहले हम डिस्कस करेंगे एनाटॉमी, देन फिजियोलॉजी, देन पैथोलॉजी एंड लास्ट माइक्रोबायोलॉजी। लेट्स स्टार्ट विथ एनाटॉमी फर्स्ट। फर्स्ट क्वेश्चन, विच इज द लॉन्गेस्ट बोन इन द ह्यूमन बॉडी? योर करेक्ट ऑप्शन इज ऑप्शन C, femur. Next question, which is the smallest bone in the human body? Your correct option is option C, stapes. Next one, how many bones are present in the adult human body? Your correct option is option C, 206. Next question, which bone is known as the collarbone? Your correct option is option B, clavicle. Next question, which bone is known as the kneecap? Your correct option is option B, patella. Next question, which is the largest sesamoid bone in the human body? Your correct option is option B, patella. Next question, which bone forms the forehead? Your correct option is option C, frontal bone. Next question, how many vertebrae are present in the human vertebral column? Your correct option is option C, 33. Next question, which is the largest bone of the skull? Your correct option is option D, parietal bone. Next question, which bone forms the heel of the foot? Your correct option is option C, calcaneus. Next question, which bone does not articulate with any other bone? Your correct option is option C, hyoid bone. Next question, which is the only movable bone of the skull? Your correct option is option C, mandible. Next question, which vertebrae is known as the atlas? Your correct option is option A, C1. Next question, which vertebra is known as the axis? Your correct option is option B, C2. Next question, which is the largest vertebra in the vertebral column? Your correct option is option C, lumbar vertebra. Next question, which bone is commonly known as the shin bone? Your correct option is option B, tibia. Next question, which is the longest bone of the upper limb? Your correct option is option D, humerus bone. Next question, which carpal bone is the largest? Your correct option is option C, capitate. Next question, which carpal bone is most commonly fractured? Your correct option is option B, scaphoid bone. Next question, which bone is commonly known as the collar bone? Your correct option is option C, clavicle. Next question, which is the strongest bone in the human body? Your correct option is option B, femur. Next question, which is the largest flat bone in the human body? Your correct option is option B, scapula. Next one, which bone is commonly called the shoulder blade? Your correct option is option C, scapula. Next question, which bone forms the forehead? Your correct option is option C, frontal bone. Next question, which is the largest facial bone? Your correct option is option C, mandible. Next question, how many pairs of ribs are present in a normal adult? Your correct option is option C, 12 pairs. Next question, how many true ribs are present in the human body? Your correct option is option C, 7 pairs. Next one, which ribs are called floating ribs? Your correct option is option D, 11th and 12th. Next one, which bone is commonly fractured in the upper limb? Your correct option is option B, clavicle. Next question, which bone forms the posterior part of the skull? Your correct option is option D, occipital bone. Next question, which bone contains the foramen magnum? Your correct option is option C, occipital bone. Next question, which bone is known as the keystone of the cranial floor? Your correct option is option B, sphenoid bone. Next question, which bone forms the bridge of the nose? Your correct option is option B, nasal bone. Next question, which is the smallest facial bone? Your correct option is option A, lacrimal bone. Next question, which bone forms the upper jaw? Your correct option is option A, mandible. Next question, which bone forms the prominence of the cheek? Your correct option is option B, zygomatic bone. Next one, which bone separates the two nasal cavities? Your correct option is option C, vomer. Next question, which bone is not a part of the cranium? Your correct option is option C, parietal bone. Next question, how many cranial bones are present in the human skull? Your correct option is option A, 8 number. Next question, how many facial bones are present in the human skull? Your correct option is option D, 14. Next question, which bone is commonly known as the breastbone? Your correct option is option C, sternum. Next question, The xiphoid process is a part of which bone? Your correct option is option B, sternum. Next one, how many pairs of false ribs are present in the human body? Your correct option is option C, 5 pairs. Next question, which ribs are called vertebrosternal ribs? Your correct option is option A, 1st to 7th ribs. Vertebrosternal ribs are also called the true ribs. Okay, moving to the next question. Question number 45. Which ribs are called vertebrochondral ribs or false ribs? Your option is option B, 8th to 10th ribs. Next question, which type of joint allows free movement? Your correct option is option C, synovial joint. Next question, which type of joint is movable? Immovable joint. Your correct option is option B, cartilaginous joint. Next one, sutures of the skull are an example of which type of joint? Your correct option is option B, fibrous joint. Next question, which type of joint is found between the vertebral bodies? Your correct option is option C, secondary cartilaginous joint. Next one, which type of joint is present between the atlas C1 and axis C2? Your correct option is option C, pivot joint. Next question, what is the scientific term for a joint? Your correct option is option A, tendon. Sorry, its actual right answer is option C, articulation. Moving to the next question, which type of joint is present at the hip? Your correct option is option B, ball and socket joint. Next question, the elbow joint is an example of which type of joint? Your correct option is option B, hinge joint. Next question, which type of joint is present between the carpal bones? Your correct option is option C, plain or gliding joint. Next question, which joint is the largest synovial joint in the human body? Your correct option is option C, knee joint. Next question, which is the largest muscle in the human body? Your correct option is option B, gluteus maximus. Next question, which is the strongest muscle in the human body based on force generated? Your correct option is option B, masseter. Next question, which is the longest muscle in the human body? Correct option is option A, sartorius muscle. Next question, which muscle is commonly known as the calf muscle? Your correct option is option C, gastrocnemius. Next question, which muscle is primarily responsible for flexion of the elbow? Your correct option is option B, biceps brachii. Next question. Which muscle is primarily responsible for extension of the elbow? Your correct option is option C, triceps brachii. Next question. Which muscle forms the shoulder contour? Your correct option is option A, deltoid. Next question. Which muscle is the chief muscle of inspiration? Your correct option is option C, diaphragm. Next question. Which muscle separates the thoracic cavity from the abdominal cavity? Your correct option is option C, diaphragm. Next question. Which muscle is known as the muscle of mastication? Your correct option is option B, masseter muscle. Next one. How many bones are present in one upper limb, including the pectoral girdle? Your correct option is option C, 32 bones. In one upper limb has 32 bones. The division is like this: clavicle 1, scapula 1, humerus 1, radius 1, ulna 1, carpals 8, 5 metacarpals and 14 phalanges. Moving to the next question. How many carpal bones are present in one hand? Your correct option is option C, 8 in number. Next question. How many metacarpal bones are present in one hand? Correct option is option B, 5. Next question. How many phalanges are present in one hand? Your correct option is option B, 14. Next question. Which bone is located on the lateral side of the forearm in the anatomical position? Your correct option is option B, radius. Next question. Which bone forms the kneecap? Your correct option is option C, patella. Next question. Which bone is commonly known as the shin bone? Your correct option is option B, tibia. Next question. Which organ is located in the mediastinum? Your correct option is option B, left lung. Next one. Which cavity contains the lung? Your correct option is option A, pericardial cavity. Next question. Which membrane directly covers the lungs? Your correct option is option B, visceral pleura. Next question. Which membrane lines the inner wall of the thoracic cavity? Your correct option is option B, parietal pleura. Next question. How many lobes are present in the left lung? Option is option C, 3. Next question. Which lung has 3 lobes? Your correct option is option A, right lung. Next question. Which lung contains the cardiac nodes? Your correct option is option A, right lung. Next question. Which lung is larger in size? Your correct option is option A, right lung. Moving to the next subject, physiology. Which is the basic structural and functional unit of human body? Your correct option is option C, cell. Next question, which organelle is known as the powerhouse of the cell? Your correct option is option C, mitochondria. Next question, which organelle is called the control center of the cell? Your correct option is option A, nucleus. Next question, which cell organelle is responsible for protein synthesis? Your correct option is option B, ribosome. Next question, which organelle is known as the suicide bag of the cell? Your correct option is option C, lysosome. Next one, which organelle modifies, packages and transport protein? Your correct option is option B, Golgi apparatus. Next question, which cell organelle is responsible for intracellular digestion? Your correct option is option C, lysosome. Next question, which type of transport requires energy in ATP form? Your correct option is option C, active transport. Next question, diffusion is the movement of molecules from. Your correct option is option B, high concentration to low concentration. Next question, which is the fluid connective tissue of the human body? Your correct option is option B, blood. Next question, what is the normal blood volume in an average adult? Your correct option is option C, 5 to 6 liters. Next question, which component forms the largest percentage of blood? Your correct option is option D, plasma. Next question, which protein is present in the highest concentration in plasma? Your correct option is option B, albumin. Next question, which plasma protein is mainly responsible for blood clotting? Your correct option is option C, fibrinogen. Next question, which blood cell is responsible for oxygen transport? Your correct option is option C, red blood cell. Next question, which pigment gives red blood cells their characteristic red color? Your correct option is option C, hemoglobin. Next question, where are red blood cells produced in adult? Your correct option is option C, red bone marrow. Next question, what is the average lifespan of RBC? Your correct option is option C, 120 days. Which organ is known as the graveyard of RBC? Your correct option is option C, spleen. Next question, which hormone stimulates the production of RBC? Your correct option is option C, erythropoietin. Next question, which organ primarily secrete the erythropoietin? Your correct option is option B, kidney. Next question, which blood group is known as the universal donor? Your correct option is option C, O negative. Next question, which blood group is known as the universal recipient? Your correct option is option D, AB positive. Next question, which blood cells may play the main role in blood clotting? Your correct option is option C, platelets. Next question, what is the normal platelet count in adult? Your correct option is option C, 1.5 lakhs to 4.5 lakhs per mm cube. Next question, which WBC is the most abundant in normal blood? Your correct option is option D, neutrophil. Next one, which WBC is known as the first line of defense against bacterial infection? Your correct option is option C, neutrophil. Next question, which WBC is responsible for antibody production? Your correct option is option C, B lymphocyte. Next question, which WBC is responsible for allergic reactions by releasing histamine? Your correct option is option B, basophil. Next question, which chamber of heart has the thickest wall? Your correct option is option D, left ventricle. Next question, which valve is present between the left atrium and left ventricle? Your correct option is option B, mitral or bicuspid valve. Next one, which valve is present between the right atrium and right ventricle? Your correct option is option C, tricuspid valve. Next question, which blood vessel is known as the largest artery in the human body? Your correct option is option C, aorta. Next question, which blood vessel carries oxygenated blood from the lungs to the heart? Your correct option is option C, pulmonary vein. Which blood vessel carries deoxygenated blood from the heart to the lungs? Your correct option is option B, pulmonary artery. Next question, which chamber of the heart receives oxygenated blood from the lungs? Your correct option is option C, left atrium. Next question, which chamber of the heart pumps oxygenated blood into the artery? Your correct option is option D, left ventricle. Next question, which chamber of the heart receives deoxygenated blood from the body? Your correct option is option C, right atrium. Next question, which chamber of the heart pumps deoxygenated blood to the lungs? Your correct option is option D, right ventricle.